One chemical can make your lungs drown in your own secretions. This is the terrifying reality of acute organophosphate pesticide poisoning. Imagine a farmer spraying crops on a windy afternoon without a protective mask. The microscopic droplets penetrate his skin and lungs to cause immediate cellular havoc. Organophosphates are potent acetylcholinesterase inhibitors that bind irreversibly to the enzyme. This action halts the degradation of acetylcholine within the synaptic cleft. The resulting massive excess of acetylcholine floods both muscarinic and nicotinic receptors. On exams, you must recognize the clinical classic presentation known by the mnemonic salivation, lacrimation, urination, defecation, gastrointestinal distress, and emesis. Look for a patient presenting with profuse sweating, pinpoint pupils, and severe bradycardia. The killer bee symptoms are bronchospasm and bronchorrhea, which cause respiratory failure. Nicotinic overstimulation at the neuromuscular junction leads to muscle fasciculations. This overstimulation ultimately causes muscle weakness and diaphragmatic paralysis. Physiological aging of the enzyme complex makes the organophosphate bond permanent over time. This irreversible bond occurs through the chemical loss of an alkyl group. Emergency management requires immediate decontamination to protect healthcare providers. The initial pharmacotherapy of choice is high-dose intravenous atropine. Atropine is a competitive muscarinic antagonist that reverses the deadly respiratory secretions. Crucially, atropine acts centrally and peripherally, but does not reverse nicotinic symptoms. To treat muscle weakness and reverse the enzyme inhibition, you must give pralidoxine. Pralidoxine regenerates active acetylcholinesterase if administered before chemical aging occurs. Remember that neostigmine or physostigmine will worsen this condition and are contraindicated. Central nervous system effects include altered mental status, seizures, and profound coma. Board questions often hide this toxicity in a suicidal patient or an agricultural worker. Always look for the combination of pinpoint pupils and wet lung sounds on physical exam. Mastering these exact autonomic mechanisms ensures you will dominate your next medical exam. Subscribe now to master more high-yield pathology and ace your upcoming board examination.